Hey there, welcome back to How to Medicate, and finally I can offer you a new video. I have been in the process of moving to a new house, and today we're standing in the new How to Medicate studio. The walls are still white, there's no furniture yet, but this will be fixed very quickly. Today I wanted to bring you a video on all the ins and outs of burnout. How can we treat it? What is a burnout? And many more you will be learning in this video. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical YouTuber from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers. Because I believe that medically educated people make healthier decisions, which is the whole point of this video and this entire channel. The video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice. And if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. So as promised, I will start by explaining what exactly a burnout is. A burnout can be characterized as a state of mental, physical and emotional exhaustion. It can cause psychological symptoms like gloom, negativism, increased irritability, emotional drain, being overwhelmed, and difficulties in dealing with other people. It might also cause physical problems like fatigue, headaches, problems with sleeping, nausea and muscle pain, mostly in your neck and pec muscles. And lastly, it could cause some mental symptoms like a decreased concentration, problems with multitasking, memory problems, difficulties with setting priorities and increased impulsive behavior. Now, burnout itself is not recognized as a distinct mental disorder. In the DSM-5, it's part of a group of disorders called adjustment disorders, the DSM-5 being one of the major diagnostic manuals. And in order to be diagnosed with a burnout, someone needs to meet at least the following criteria. A person needs to experience emotional, physical and mental exhaustion, and these complaints need to last at least 6 months or longer. Then there are several risk factors that might increase your chances on developing a burnout. High levels of stress, not being able to realize your goals, having work with a lot of pressure and little autonomy, having little social support and experiencing injustice. And the burnout can also co-occur with other mental health disorders like depression, stress complaints and anxiety disorders. Which brings us to the prevalence of a burnout, which is a fancy medical word of describing how common a certain disease is. Recent studies have shown us that a random person's risk to develop a burnout in the following 12 months is about 1.5%. The lifetime risk of the general population is about 4.2%. Which finally brings us to how to treat a burnout. And your treatment plan might include lifestyle interventions, medication and psychological treatment. Therefore, let's start off with the basics, lifestyle interventions. And here it is important to take good care of yourself, psychologically but also physically. This means change your clothes at least a few times a week, shower regularly, maintain a tidy home and workspace, and keep a structured sleeping schedule. Try to wake up and sleep at fixed times and make sure to sleep at least 7 to 9 hours each night. Try to avoid sleeping during the day and make sure to plan your day. This might give you purpose and helps with structuring your days. Here it might also be helpful to plan some activities outside the house. Go for a walk or a quick run or visit a relative or a loved one. Next up, follow a healthy diet. Eat enough vegetables, vitamins and drink enough water. At least 1.5 to 2 liters of water each day. If you try to implement all of these but it is insufficient, then please contact your doctor. He or she might help you to come up with a proper treatment plan. Now your doctor might start with psychological treatment. This can be followed individually, with your family or in a group setting. Your doctor might start with psychoeducation, providing you with insights on your burnout and certain provoking and supporting factors. Furthermore, your doctor might encourage you to structure and plan your days, set goals and provide you with certain exercises to overcome your complaints. In addition, cognitive behavioral therapy might be helpful. This therapy aims to help you identify and understand your behavior, thoughts and negative beliefs, after which it tries to help you replacing them with healthy and positive ones. Furthermore, you could benefit from several time management strategies, stress management treatments, occupation therapy or light therapy. And lastly, as mentioned, depending on your precise symptoms and other co-occurring disorders, your doctor could prescribe medication. most commonly antidepressants, mood stabilizers or anti-anxiety medication. For more information on any of these, check out the playlist in the description where I made specific in-depth videos on several of these drugs. Now, I hope this video was helpful and I hope you now know what a burnout is and how your treatment plan could look like. If you have any questions, let me know in the comment section below and I will do my best to answer all of your questions. For those of you that want to keep on learning or that have any questions on any of the drugs, check out the playlist below to find any of the appropriate videos. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to hit 100,000 subscribers before the end of the year in my new studio, and you could help me reach that goal. All that rests me now is to thank my sponsors on Patreon. Thank you, Sebastian, who's an investor to your supporter. And if you want to help the channel out, spread the medical knowledge, feel free to also become a Patreon supporter. Thank you all for watching, and I will see you next week with a new video. Don't forget to subscribe. Bye bye.